Our speaker, Dan Weissmann, is a veteran reporter for outlets like Marketplace, 99% Invisible, Planet Money, and Chicago's WBEZ. His work reflects sophisticated reporting, an engaging narrative voice, and a knack for snappy, accurate breakdowns of complex subjects, from urban segregation to the economics of America's largest crop, to the engineering miracles that turned the Chicago River into a sewer. He's currently the creator and host of the acclaimed podcast An Arm and a Leg, a show about the cost of healthcare, which was voted the #2 best true crime podcast in the 2019 Discover Pods Awards. You can find more of his work at danweissman.com, but without further ado, let's welcome him up.
Thank you so much for that introduction. Hi, everybody. Thank you so much for having me. I'm Dan Weissmann. So one of the first questions has been answered, like, who are you? What are you doing here? Yeah, I'm a reporter, and I do a show about the cost of healthcare, and it is called An Arm and a Leg. It's a podcast, which means it comes to you via the internet, and you can listen to it on our website or anywhere you get podcasts if you like that kind of thing. And what I thought I'd do is I'd talk to you first a little bit about how the show came to be and why I do it, which informs kind of the kind of show that it is, and then talk you through a little bit of what we've done so far and where we're headed. So, how does anyone come to start a show about the cost of healthcare in the United States, and how did it end up being me? And there's a couple of answers to that, and one of them is it's an interesting topic. As a reporter, you tend to kind of look for what's important, for what's interesting, and what's kind of underwitnessed. And for a long time, this had been on my mind. I mean, I remember 10, 11 years ago, I interviewed a woman. I was hosting a show. At the time, we would talk to people on the phone, and we kind of booked this woman to talk with about her dad's death. And we were on the phone, I was on the phone, on the air with her for like an hour. And the story was horrifying. It was a story about her dad was in a home, he was older, and they were waiting, and the details of this is a long time ago, and details kind of escaped me. They were waiting for another level of benefit to kick in, where he could go someplace a little nicer. But they were kind of they weren't able to do that yet, they weren't able to afford it. And he kept ending up in the emergency room. And the reason he ended up in the emergency room was because he was dehydrating, because nobody was just kind of making sure that he was getting fluids, that he was eating. And this happened again and again, and eventually he died in exactly this way. And it was heartbreaking. By the end of the hour, I was crying, she was crying. It was pretty harrowing. And I was like, this seems like kind of a big deal. I had kind of understood. I'd been a freelancer. I'd had to pay for my own health insurance, and I knew it was super expensive. If anyone's ever had that experience of leaving a job and having to kind of pay for your own for a minute and seeing what your boss is paying, it's like, holy moly. Am I allowed to swear here? Okay, great. Yeah, I'll start mild. But like, holy crap, that's a lot of money. And I had shopped for health insurance in pre-Obamacare days when I have a little heart condition that I was born with that doesn't affect my life in any way, except I have to go see a doctor every once in a while to get it monitored. But it's a pre-existing condition that meant that I was in this whole other realm of buying health insurance. So I was pretty aware that this was a big deal for a lot of people. And I would pitch to editors like, hey, I think this is a thing we could do. When I was working at Marketplace, when I was working for WBEZ, I was like, I think this is a big deal. Like, how much this costs and how many people it affects. This is, and how big these stories are. Because one of the things, like that woman's story illustrated, is these are stories that are, on the one hand, super intimate, right? Being vulnerable, being sick, living and dying, and that they involve people's families, right? That anyone who gets sick and dies, or doesn't die, or has a financial crisis, this involves a whole community of people. These are really intimate stories, they're really dramatic stories. And they're stories that also kind of take us right to the top level, right? Of like, how does our economy work? What is our government doing? What are the rules? What should they be? We have elections over these kinds of things. So that seemed to me like it's pretty famously said, like, healthcare's like, these days, often said like a sixth of the economy, right? Like, so this as a reporter, these are the kind of stories that seem pretty interesting. And like, they would have a pretty wide audience. And the people I worked with were like, that's a cool idea. Everybody here has a cool idea. We'll let you know if we want to do yours. it didn't happen to come up. So I had a long-standing personal interest, and then I left a job. And it was, this is about 2.5 years ago, I left a job, I was working for WBEZ, and it was just kind of time for me to leave that place. And I was like, well, this is not so good, though, because I kind of plan to always be here because my family's here in Chicago. We're here. And I'm not leaving. And that's the employer. That's like the W-2 health insurance giving employer around here. I was like, I might need another career, which I was really unhappy about because I really love being a reporter. It's like my favorite thing. And so I gave myself a few months to get used to the idea. And then I was scheduled, 2 years ago, very beginning of 2018 to start looking for a new career. I was like, okay, here it goes. But I had this one idea, and I thought maybe I was done as a reporter. I was like, maybe I've had my run. I've been doing it more than 20 years. Maybe that was it. But when someone said, like, well, are you sure you want to give it up? I was like, well, there's this one thing. And it was this. It's the cost of healthcare and what it means to people. So I gave myself a week to talk to some people, just to kind of kick the idea around, like, is there room for a show like this? Could this be a thing? Because, podcasts, seem like kind of a big thing. And I knew people who had created them. I'd been keeping my eye on how they grew as a business. And I was like, well, I got some questions to answer. Let me go see what I can find out. And the first thing, there were two or three things that happened when I started talking to people. And one of them was, people asked, like, well, who's going to listen to a show that's just a parade of horror stories? Like, it's one thing if I'm, like, listening to All Things Considered or reading the newspaper and one of these stories comes up and I'm like, that's really interesting. It's another thing to ask me to, like, voluntarily choose to listen to one of those stories every single week. That seems like a heavy lift. And I was like, that is a darn good point. That's really true. But then the other thing that happened was I was talking to people, just people that I knew. And as it turned out, everybody had a story. Like, this guy Pablo, whose kid goes to my kid's school, I just mentioned it to him. I was, hey, I'm thinking about doing this. He was like, oh yeah, that's super important because, my wife makes a lot less money than I do, but she has really good health insurance. We make sure she stays in that job. And, a couple of years ago, we were moving. And I was kind of out of breath at the end of the day, which was unusual. I'm in good shape. I went to see the doctor the next day, and she was like, you had a heart attack. And the nurse was like, yeah, the next time you felt winded like that, you'd be dead. And he walked out of the hospital a week later after $300,000 worth of treatment. Yeah, but which was fine because they had the insurance, but that was, this was a specter hanging over their family. I talked with my friend Nyla, who was working in public radio, working for the state government, owned the station that she worked with. She was like, I'm a state employee. I have the world's best insurance. And Dan, as you know, I spent the last year battling breast cancer. But I had great insurance. But, guess what happened? At the end of the year, I get all these bills. And I open the envelopes, I'm just crying. And I was like, didn't you cover your deductible? She was like, I thought so, and my insurance company thought so. I was, checking the website, and, but then at the end of the day, they were like, oh, yeah, well, it turns out there's this other stuff. It turned out you're not totally covered. And so she's, at the end of this year, she's dealing with all these bills, and she's like, oh, yeah, and then I'm still fighting with them because they didn't want to pay for the wig when my hair fell out. And she was like, I'm lucky. Because I have really great insurance. Women who were treated with me were doing GoFundMes to fund their chemotherapy. And I was like, okay. I can see some of you getting a little emotional. I do too. This is a big deal. But, we are the lucky ones. And then, my friend Peter's a real estate developer. And he was like, yeah, it's interesting. Oh, yeah, did I tell you about last year when I had the kidney stones? And I was like, no, you didn't tell me about that. Well, he was like, I avoid going to the doctor whenever I can. It seems like a big ripoff to me. But I finally, it was so bad, I let my wife drag me to the emergency room, and I let them talk me into having a CAT scan. And it told me what I already knew, which was that I had a kidney stone and it was passing. And it cost $6,500. And his family has a giant high deductible on their plan, so it was, his to pay. And I was like, Peter, what's funny about this is you're a real estate developer. And you are one of two people like this that I know. Your job is to bargain with sharks, banks and contractors and stuff. And you do this, nobody I know can do this. You do this, and you don't feel like you can negotiate this. He's like, nope, I can't. I was like, I think I may be onto something here. Because this isn't just, the dramatic stories of, the person who got the $500,000 invoice for their first 6 weeks of dialysis. This is like everybody that I knew suddenly was like, yeah, I got this story. I was like, well, that's darn interesting. That's interesting. So that week turned into another couple weeks, and it just kept kind of turning into more because there kept being more stories. So let's see, can I do this? So this is it. So I decided this slogan didn't emerge overnight, but this is kind of what I now say the show is. It's a show about the cost of healthcare that's more entertaining, empowering, and occasionally useful than enraging and terrifying and depressing. That's my goal. That we may be screwed, but we're together and we can help figure it out. And there's a thing that I thought about with this show, which is, it's true. Like, it can't be a parade of horror stories, and it's also true. There's a place for a show like this, because there are, I would say, three major buckets of stories. There's stories about healthcare and the cost of healthcare. We see them all the time, right? They're staples in our newspapers. And I would say there's like three buckets. And one is the horror story bucket. And the other is like the politics bucket, right? Like, that was the beginning of 2018. So we just had a whole year of like, the Republicans want to end Obamacare and the Democrats want to propose this, right? Like, we have all these stories. It's like kind of political maneuvering stories, really. And then there's the third bucket of stories that are like, I would call them like the Migos stories, the my eyes glaze over stories of like, this chain of hospitals is merging with that chain of hospitals and they're projected to have this kind of, and I'm like, I don't understand what this means, right? Like, I get that this has implications, but I don't really understand them as a regular person. So I was like, I think there might be room for this. Because I don't know, I'm smart enough, I care. But I can't figure this stuff out, like what's actually going on, what's at stake in these other stories. And I don't feel like I'm getting enlightened by the other stories that I see. So, okay, there's room for this. So there's one, and then there was this one other conversation that I had when I was talking just about the idea of doing this show. And a friend of mine has, for like 30 years almost, made his living performing at Renaissance festivals. And it was like, oh yeah, we have something like this. It's called the Rescue Foundation. And I was like, I think I can sell that story someplace. And so it turns, I called it the people at Planet Money, and I was like, would you like this story? They were like, we would like that story. So this is the story. People who work at Renaissance fairs have a kind of very acute case of this problem, because you don't make a lot of money dressing up in tights. And it's an itinerant existence. Right? You don't have a regular employer, and you don't live in one place. So even if you qualify for Medicaid or you have an Obamacare policy or whatever, well, that policy, happens in one state. It qualifies you for care in one place. And if you spend a couple months in North Carolina and a couple months in Arizona and a couple months in Kenosha, the network that you're qualified for care in does not follow you around. So it's pretty tough. And people who work in this world I've had this problem for a long time. And they have, as you might imagine, if you know people who work in this world, you've visited them, they have a kind of like a hippie mutual aid ethos. And so they've always had a kind of ethos of helping each other out. And 15 years ago or so, some of them noticed but it's not a perfect setup, because when someone's kid gets sick and the people whose kid it is are well known in our community, they perform on a big stage and everybody knows them, there's a big effort to rally around them and raise money. But some other family who's making pewter pots and selling them over on the, over the side, don't get the same kind of treatment. They're we ought to do something about it. So they did. And it's this kind of terrific story. They banded, they were we'll do fundraisers. And they went to the thrift store and they got junk and they made up stories about it. And they auctioned them off for tremendous amounts of money. They had they had a comb with tissue paper, and they were this is the Gutenberg paper dryer for when things come off the printing press. And they sold it for $150 because it was just such a fun story and people wanted to support each other. So they raised this money and they would pass it around at the campfire. You had that broken wrist here. And eventually they figured out they needed kind of more bureaucracy, and they built it. It's very, very lean. It's very, very small. But now we have the internet and they have conference calling. They've built a little 501c3 organization. And that organization has paid down about $500,000 worth of medical bills over a 5-year period, which is cool. But what's cooler is that they've actually made $2 million worth of healthcare bills go away. because they have somebody. They have like if you run into trouble, you're one of these folks, you get in touch, and they put you in touch with Kaylin. And Kaylin used to sell belly dancing outfits at Renaissance fairs, and then she kind of got off the road, and now she is a real estate broker in the mountains of Virginia. But she's been connected to this organization all this time. She needed its help one time, and she kind of inherited and refined this job of being the kind of advocacy director. And so if you have this problem, they'll put you in touch with Kaylin, and Kaylin will teach you how to advocate for yourself. Like, what you should call the hospital and ask them what their charity care policy is. Ask them, do they have financial aid? And if there's no official channel to go through, like she kind of trains people on what it is to like call the doctor's office and say like, can you help us out? What can we do? She connects people with resources and teaches people how to advocate for themselves. And so working like 20 hours a week for like $20,000 a year, Kaylin has helped people knock out like $2 million worth of medical bills. I thought that was pretty cool. And I was like, I think I might have something here. So it worked. Planet Money bought that story. It was a prototype for me. We launched the show in November of 2018. And, we're doing it. And so we did one season, and one thing that I said was like, I want people to send in stories right away. And people did. So our second season featured a lot of stories of people who had sent in stuff. Like, hundreds of people have sent in stories to this show, which is super cool. These folks, Corey and Caitlin, wrote me like the week the show opened, and that's their baby. Caitlin was pregnant, and in September of 2018, and in October of 2018, when she was 6 months pregnant, they got a note from their insurance company. They're like, "We're dropping you. You didn't pay." They're like, "What are you talking about? We paid." And they just couldn't get anybody on the phone to take them seriously. And then there were complications with the pregnancy. Caitlin ended up in the hospital twice, and they were, they were amazingly persistent. They were amazingly resourceful, and they just couldn't get anywhere. So, they wrote to me among other people, and when our season was over, they were one of the first people I was like, I'm calling these people back. So I met them in March of 2019. And Maggie had been born in January. She was adorable. They were fine. They had gotten some help by basically calling their senator. And their senator came from someone in the state, and the state person had took them with one thing, and basically gotten them some insurance to cover. But it wasn't the insurance they'd originally signed up for, so it didn't really cover both hospitals they'd been to, like their old policy would have. They still had instead of $20,000 worth of bills with this new insurance, they had $10,000 worth of bills. And but this was an interesting thing where I called, once I spent a day listening to their story, and it took all day. I said, I'm coming to Minneapolis, we're going to talk. And we talked for 6.5 hours. That's how long it took to go through everything they had done. Right? They dug up their calendar. They had all these stacks of files, everyone they had called. We had to go through the whole chronology. And, it was an emotional day. And then I came home and I started, started figuring it out and cutting it down to something that would be 20 minutes long. And then the last step was I'm a reporter, I got to call the insurance company that booted them. And I called the insurance company, and the insurance company was like, I told them, and it's one of the fun parts of being a reporter, is calling these people and being I've been talking to Corey and Caitlin, and this is what they're telling me, and telling them exactly the story as I would tell it on the radio, right? And what it sounds like, what they sound like, just so you know. There's no surprises. And they were like, okay, we'll get back to you. We'll call you tomorrow. I was like, good, because I'm on deadline. I'm putting this thing out. They're like, great. And that was the end of the day, and the middle of the day, I hadn't heard from them. Before I can call them, I get a call from Corey and Kate, and they're like, guess who called us to say they want to make it right? I was like, no. You're like, yeah. So the insurance organization, Health Partners, never ended up talking to me. But they were like, we're working it out with our clients. But it worked out for Corey and Caitlin. But it was also they went through 6 months of total insanity, right? We talked with them a couple months ago, and they were like, we haven't really finished catching up with your show because there's just kind of some PTSD there. It was tough. So season 2, you included their story. This guy here wrote to me. He's a woodworker, and he got his thumb caught in the buzzsaw, and he was like, I can't afford health insurance, can't afford all the deductible. And he was actually fine. Like, the story was actually that he went to the he went to urgent care, he made his buddy drive him to urgent care, and the urgent care doc was like, I can't do anything with this. You have to go to the emergency room. He's like, don't make me go to the emergency room. I know how much that costs. He's like, you have to go. And they went, and the emergency room doc was great and patched him up and sewed his finger back on. And on his way out of the emergency room, he stops to sign something, and the woman there is like, if you put down $350 right now, it's like 60% off. And he was like, yeah. He was like, okay, that sounds kind of good. And it's one of, this story ended up being about how, we're in this weird cycle where hospitals and providers have made up these incredible prices because they're expecting to be like at the bargaining table with insurance companies. They're like, we think sewing this guy's finger back on is like $10,000, and the insurance company's like, that's ridiculous, $5,000, not a penny more. And like, okay, $5,000, when like they'd be really happy with $2,000, but they're getting $5,000. But then this guy shows up with no insurance, and they're like, what do we like? They want to cut him this deal because they'd much rather have $4,000 than nothing, right? You hit him with a deal for $10,000, people just go away. So this story ended up being about how hospitals are like everybody's caught, and in fact, I get a lot of email, and a lot of the email I get is from doctors, from hospital administrators, from insurance salespeople, insurance brokers, insurance executives. One of the interesting things is like everybody's caught. Everybody's caught up in this. Like, this is not a game that nobody's winning. Well, there may be some people who are winning, but doctors and nurses and people who just need a job and end up in the billing office at a hospital did not go into this to be part of some giant national torture machine, right? They didn't go into this to try to wreck people's lives or wreck the economy. So I get a lot of tips. Season 2 was a lot of tips. This woman here, Liz Salmi, is an amazing person. She's been living with brain cancer for 10 years. She switched insurance, and her old insurance was actually an HMO that she was really happy with, and her new insurance was like insurance, and you have to figure it out. And it's one of the other things that I've learned is like, oh my God, insurance is really complicated. Like shopping if you have to shop for your own insurance, you're shopping for a very sophisticated financial product, right? It's like shopping for a hedge fund. If you're talking to Blue Cross about a policy, they're trying to tell you they've got an enormous army of people figuring out all the financials of like how that policy is structured. It's a financial instrument, and you are completely outmatched. And so, she's been actually working in health policy for a while. She called a friend. She was like, how do I pick insurance? And her friend was like, this stuff's really complicated. I'm not really sure, but pick the most expensive one. It's probably the best one for you because, you're living with brain cancer. She's like, okay, great. And she picks the most expensive one, and she finds a hospital that works. And she goes, and she gets, every 6 months, she has to get an MRI just to make sure the cancer's still at bay. And she goes, and it's great. And then she gets a bill, and the bill is for like $1,600. And she's like, this can't be right. That's like, she's like, we save up all year so we can go to Disneyland for a week. Me and my husband, we love Disneyland. $1,600 is like a really fancy week at Disneyland for us. And that's where that $1,600 is supposed to go. But like, oh wait, isn't there this thing where like insurance pays part and I pay, but this must be what the insurance is getting charged. Then she looks it all up. It's like, no. Like the sticker price is like $10,000. The $1,600 is her part. She's like, this sucks. And so she goes looking around, and it turns out that there are these places that Liz calls MRI are us, right? They're like freestanding clinics, and like she has time. She has 6 months. She shops around, and the next time she gets an MRI, she goes someplace where it's like $87 out of pocket. And by the time she's changed back into her street clothes, they're handing her a CD with her scans on it and a bag with 2 fresh chocolate chip cookies in it. So she's like, you can shop around, it turns out. There's a whole question of like, where do these prices even come from? mean, it's one of the things about every one of these stories is like, they're interesting stories, and it's like, where do these prices even come from? So, and it turns out, someone who I now work with, Elizabeth Rosenthal, who's she was a New York Times reporter for many years. She's a MD, actually. Her last years at the Times, she spent working on a series called Paying Till It Hurts, about the cost of healthcare. She wrote a book called An American Sickness, about the cost of healthcare. And now she runs a group called Kaiser Health News, which shares a kind of family relationship with Kaiser Permanente, the big healthcare provider. This is a little bit of a dogleg. Henry J. Kaiser was like this mid-20th century version of Elon Musk. He poured concrete for the Hoover Dam and half the basements in California in the middle of the 20th century. He built the U.S. cargo fleet for World War II. He made steel. He smelted aluminum. He started a small regional TV network based in Hawaii. And, he just had his hands in a lot of stuff. And during World War II, he created clinics in the shipyards where he was building these Liberty ships because he couldn't, labor was short. He couldn't afford people to be all out of work and sick and not get well. And that grew into Kaiser Permanente, which does half the healthcare in California these days. And when he died in the mid-'60s, he left half of his fortune to a family foundation, which just made grants like any other foundation for a long time. And then in the late 80s, this guy came and took it over. He was like, what this country needs is a think tank about healthcare. I don't know why. It's a good idea. I'm glad he did it. But he was like, and so it became like the Pew Charitable Trusts, which, they run polls, they do research. It's kind of independent information for policymakers and journalists and everybody. And the Kaiser Family Foundation became that for healthcare. And then 10 years ago or so, they noticed, we're getting fewer calls from reporters. Because they're all being laid off, right? The newspaper industry's, in the death spiral. And so they noticed this nonprofit newsroom called ProPublica was starting. They're like, we could do that for healthcare. And so that's what they did. And so Kaiser Health News is this independent newsroom on a nonprofit basis that writes about healthcare in America. And Elizabeth Rosenthal, I'd read her book when I was starting the project, and I wrote to her at the end of season 1. I was like, I'm a fan, and I'm interviewing one of your reporters in the episode we're airing tonight. She was like, that's really interesting. I've been meaning to get in touch with you. I like your show. Want to work together? So we're now collaborating. So she was, and they are now our kind of co-publishers. I forget what name we give them, but they give us some money, and we talk with them all the time, and I talk with some of their editors every week, and we get advice from them, and they're terrific partners. And so she was my source. I was like, Elizabeth Rosenthal, what is the deal with MRI prices? She was like, it's like booze at a fancy restaurant. It's a profit center for a hospital. You just charge whatever you want. You mark it up as much as you want. Especially because it's inpatient. Some people are inpatients. What are they going to do? So that's what they do. So yeah, season 2 was super interesting. For season 3, I was like, what we should really be talking about is self-defense. The cavalry's not coming. No matter who gets elected president in the next year, if the presidential candidate of your dreams gets elected in the next year, and their dream Congress gets elected with them, and they pass dream legislation in the first 100 days, that's still a year and a half from now. And then there's a rulemaking process, and then there's implementation, and there's all kinds of things. At the very earliest, we're talking if that law gets passed, in this record-breaking time, it's mid-2021. For the health insurance industry, 2022 is over. It's in the books. It's all written down. Because if you're Blue Cross and you're negotiating with Advocate, you need to work out all of your 2022 pricing by the spring, so that then the people at Blue Cross will be like, okay, we did our deal with Advocate, we did our deal with these people over here. This is what our premiums are going to be for next year. This is what our policies are going to be. Then you run it by the state regulators who have to approve everything. And then you run it by your customers, the large employers, right? So by the springtime, everything's done. So if everything runs in the fastest possible schedule, it's 2023. And that's World War II level mobilization. Which, if I were to go to Las Vegas and lay odds for that sort of thing, the odds I'd get a lot of zeros in those odds, right? And that's the best case scenario. That's the crazy case scenario. So, yeah, the cavalry's not, this is am I being kind of more of a drag than I'm supposed to be? That's, it's not really that cheerful, but I was like, well, we got to be able to do something in the meantime. Oh yeah, insulin. People are trying to figure out how to make home-brewed open source insulin. It's great. I mean, the things that people are doing are really, really cool. So like, this is our next season. So that was the season we just wrapped up, is about self-defense. And there are, let's see, now I'm like, okay, let me make sure I got all this. Yeah, so let's look at the next thing. So I'll talk about a couple of stories that we did this season. One is, so we decided not to call this After All, Can They Fucking Do That? But we wanted to. But this is, we kind of felt like, our email would get blocked by spam blockers, all kinds of things. We decided to go with this. But so yeah, this story is one of a bunch of them. Like, I get all this email, and Kaiser Health gets a lot of email too. They do this series called Bill of the Month with NPR. We have a lot of these stories, and this one was one of them where I was just like, can they even do that? This woman went to a clinic, and it was covered by her insurance. And she got a bill from them, and she paid it. But she paid $30. And then a couple weeks later, she gets this other bill in like a hot pink envelope which looks fake to her. It looks weird, sketchy. She's never heard of who it's from. They want $35 from her. She's like, and she ignores it, which is not that wise, it turns out. I mean, you could guess. And then another one comes, and it says like, oh yeah, we still want this $35, but if you don't pay us right now, it's $1,300. And she's like, this cannot be real. The voice is like, I pray to God this can't be real. And she does this really unwise thing, which she ignores that one. And then a couple of months later, she's getting a call from a collection agency saying, like, we want that $1,300. And she's so freaked out, she puts her dad on the phone with them, and her dad talks them down to like 217, which is, 1/6 of $1,300, but it's 6 times $35. So like, that's insane. Like, and we wanted to know, like, can they do that? So I called a bunch of health policy nerds. And they were all like, oh, that's very interesting. That $35 bill, that was a surprise bill. I'm like, no, you don't get it. Like, there's, what about the $1,000? But they were like, no, this is interesting. And so surprise bills are this kind of thing where like you go one place, it's covered by your insurance, and they farm something out to somebody else that doesn't take your insurance without telling you about it. And you get a bill from that person. And $35 is like, the easy case. Like, you could pay the $35. It's weird, but you could. But like the big cases are like emergency rooms. Many, many emergency rooms, the doctors don't work for the hospital. And this is partly because if you're running a hospital, staffing an emergency room, it's like running a McDonald's, right? It's like running a 24-hour diner. We're like, oh, the fry cook called in sick, we got to get somebody. Except the fry cook's like an MD, who spent years in training. Like, somebody called in, you just can't just get somebody. It's very complicated. It's very difficult. And so over the years, companies sprung up called physician staffing firms. They're like, we've got this. The doctors work for us. They work in your emergency room. They work for us. We'll even handle the billing. You don't pay us a dime. So over time, and apparently these things started as kind of innocuous things. Like, it's a service. It works. Over time, they were like, somebody figured out, like, who said we had to take insurance? So if you go to an emergency room that's like staffed by these rooms, they may not take your insurance. And then somebody figured out, who worked in private equity, like, that sounds like an awfully good business to be in. So a lot of these physician staffing firms are now owned by hedge funds. Yeah, you're like, those guys. So yeah, I mean, I try to keep this as more entertaining and empowering and useful than enraging and terrifying and depressing. But it is very enraging and terrifying and depressing. But so surprise bills are a whole thing. We ended up going way into it. But then the question still was like, what about the $1,000 late fee? And the health policy nerds were all like, I don't know, the law's really unsettled there. So I ended up going deeper, and there are people whose jobs it is to be like Kaylin Globuk, who works with the Renaissance Fair workers, who like, you have a crazy bill and you call them, they're like, we're going to help you resolve this. And I started calling those people. And at first they were like, the first person I called, he was like, $1,300, that's a new one. That's pretty bold, And he was like, I don't know, like I don't know what the law is exactly. I'm not a lawyer, and I think you probably have to get a lawyer to tell you, and the lawyer will probably charge you $1,300, and that's probably their business model. He's like, but I know a couple of people. And so I ended up talking to somebody who'd been doing this for like 30 years. And she was like, well, yeah, that's ridiculous. You could take them to small claims court. I was like, you could? She's like, I do it all the time. And the other person I called with that guy's tip was a law professor at the University of Arizona. And he was like, well, yeah, from a contracts law perspective, this is like shooting fish in a barrel. I mean, you enter into a contract with these people theoretically when they care for you, but a contract doesn't mean that they can just charge you whatever they want. And so they ran through the process of like how to figure out like what is a reasonable, like basically there are resources you can go to figure out what's a reasonable rate to pay. And you can't ignore their bill. You call them and you're like, I've researched this is what a reasonable rate is. I'm willing to pay you this. And please accept this. And if you don't accept it, if I don't hear from you by date X that you accept it, I'm going to file a claim against you in small claims court. And this is something that I learned. Some of you may know this. When you take someone to court, it doesn't have to be like, you did me wrong, I want money from you. You can also go to the court and be like, I have a dispute with this person. Help us settle it. And in this case, this person is telling me I owe them $1,300, and I've looked it up, and it's fair, and I'm offering them something fair. I'm offering them $35. Please make them take $35. Yeah, right? It turns out this is a thing courts do, and it works. And what these people told me was like, you do this, and they'll be like if you just tell them you're going to take them to small claims court, they'll be like, great, I'll take your offer. If you actually file, they call you even faster. Because it's a losing proposition for them to come and fight you because A, they're going to lose. But B, even just going to fight you is crazy for them because what their business model is sitting in an office sending out pieces of paper that say, pay me $1,300. And they get $1,300. Or they get a phone call and spend 10 minutes on the phone with you and they're like, okay, I'll take $200. Like to actually schlep themselves to court where they probably will lose anyway, it's way easier for them to settle with you. So I was like, that's pretty cool. That's interesting. So that, I was like, we could do more of that. This is the other kind of standout story for me from this season was Wendy Thomas. Wendy C. Thomas is a reporter. That, you hear stories of reporters like calling someone out and this bill is crazy. This person got this crazy bill, and the person sending the bill is like, oh, we're so sorry, we give up. And like when I called the insurance company that screwed over Corey and Caitlin, right? They were really happy to. And that's nice, but there's way more stories than there are reporters. So Wendy Thomas scaled up. And she found the biggest hospital in her city, Memphis, Tennessee, was suing thousands of its own patients, including more than 150 of its own badly paid employees. And she did the work. I mean, in one sense, this was all going on in plain sight. Like, if you knew that it was happening, you could show up to court, and like once a week, there was a whole courtroom that did nothing but these cases in this one hospital every Wednesday morning. Yeah, which is it's a little bit upsetting. It's more than a little upsetting. And Wendy Thomas did the work to like nail this story down, and she published it in late June. And immediately, the hospital's like, we're going to review our policies. And they did. And by mid-September, they were like, we're dropping these cases. And we're raising the minimum wage for our workers. That was pretty cool. So that's what we do. That's the show. We just wrapped season 3. And it's been nice. People said nice things about the show. I'm really happy about it. That's great. That's cool. What's next? And I think what's next for us are 2 things. One is, cursing's allowed here. One is, people send us emails and people are starting to alert us on Twitter and on social media when there are things we should be aware of. So I signed on to TikTok for the first time to be able to, I installed it on my phone to watch this video. Let's see if this works. Yeah, here we go. Come on. Oh wait, no, let's get the volume going. Okay.
Scenario. You go to the emergency room, you get a bill for $1,000. The very first thing you do, other than calling and asking for a review of the level of care, that's the first thing you do. While on the phone, while they're doing that, you also say, I want an itemized bill with every single charge. Now what they're going to do on the back end of that, because they don't want you to know that they've charged you $37 for a fucking Band-Aid, they're going to take that $37 charge right off of there. Before they send you the itemized statement, any of those stupid charges, they're going to take them right off. Generally, my bills go from $1,000 to $750. They take about $200 off just for stupid shit. And all you have to do is ask for an itemized bill with every charge. And they're going to take those charges off because they don't want you to know that they're charging you $37 for a fucking Band-Aid. And guess what? That's how much they charge for a fucking Band-Aid. So when you actually can say, you charge me $37 for a Band-Aid, they don't like that. So they win.
So she has published a bunch of these. She's fantastic. She's amazing. Here, let's go back to the presentation mode. There we go. And so she became the hero of the next issue of our newsletter. I was like, because we only put out so many episodes, but we have a newsletter that comes out, and she's whoop. Okay, come on. Come on. Okay, act right. There we go. Sorry. So this is our newsletter. This is the issue that went out a week or two ago. And I did a lot of work because she's a very prolific TikToker. There's like a lot. She did these in early December. She did like a dozen of these in early December, and she's done like hundreds of videos since then. How to clean your bathroom. Stories about her upbringing in a group home. Dozens and dozens of entries from her bullet journals. She's charming and I love her. But it took a lot of work to run these down. So we put all that together. And I think in some ways, like, one thing that the show should be doing, one thing that our project for this year is, like, we should be looking at, like, well, how can we bring this kind of community together? Like, we make a show, but one slogan that we don't put on the website, but that I'll share with you, because I share with people I work with, is that, this doesn't want to just be a show that's looking to address an audience. This wants to be a project to engage a public, right? And so the show wants to reach as many people as we can, because we need as big a public as we can get. But we're starting, and so that's our question for this year. It's like, this is starting to happen. We're starting to get these tweets that alert me to, like, what other people are doing. Like, how do we do that? So that's one. And the other is inspired by Wendy Thomas. I think the next season of the show is going to kind of look at the broader horizon. Healthcare is said to be, 18 to 20% of our economy and growing. I'm now the kind of person who sees when these studies comes out and notices some of them. The cost of employer-sponsored health insurance for a family, on average, is $20,000, which is the price of a new car. And a study just came out this last week saying that essentially the cost of all of this is $8,000 per person in our country. And so the question I think we should be addressing this next season is, like, where does that money go? Whose pockets does it end up in? Because another statistic that I now find is very common is to say that a third of that $3 trillion is waste. And as people are fond of saying, like, what some people call waste, other people call income. So this is something Wendy Thomas, before she started her current project, spent a year at Harvard, and she recalled for me something that one of the professors said that she's kind of extended. And let's see if it plays here.
What if poverty isn't an accident, but it's a robbery? I believe poverty is a robbery. And if it's a robbery, then there are thieves. And the thieves' names can be known.
So I think that's one of our projects. Who are the thieves? Can we name them? What can we do about it? So that's it. That's what we're doing this year. That's our story. I'd love for you to look us up, listen to the show. You can find us on the web, you can find us on Facebook, you can find us on Twitter, you can find us wherever you get podcasts. And I very much encourage you to sign up for our newsletter. We're at armandalegshow.com/newsletter. We just wrapped season 3. We're going to do kind of a bonus episode later in January, debriefing with a fellow reporter, a woman named Sally Herships, who does a lot of work for Marketplace and Planet Money, and she's just a really great human being. And I'm talking with folks at Kaiser Health News tomorrow. I'm meeting with my editor and our consulting managing producer next weekend in New York to kind of map out what our plans are for the next year. So it's going to be a few months before we're back. So the newsletter and the website and all that. We've got 24 episodes for you to listen to, which I hope you do. But I also hope you'll sign up for the newsletter. I hope you'll follow us on social media. I hope you'll kind of help us figure out what we can all do together, because that's the job. Thank you.
Thank you. Very entertaining and depressing. From what you've been doing overtime, what do you think of the pros and cons of getting rid of healthcare insurance companies and going at it in a more direct way?
Super good question. There's a couple ways to answer that question, right? And one of them is, when part of the conversation about the idea of like Medicare for all, getting rid of insurance companies, having government run things is like, gosh, a lot of people would be put out of work, which is super interesting. Like 2 million people is one of the estimates of like people whose jobs it is to work in doctors' offices, figuring out how to bill for stuff, and on the other hand, in insurance companies, figuring out how to fight those bills, right? And I don't know, to me, it seems like it seems to me from now looking at this up for a couple years that, capitalism does not seem to be like the absolute best way to provide healthcare for people and to kind of efficiently distribute resources. It seems like there's people have a priori beliefs about this kind of thing and about whether markets are the best thing to do anything. I don't happen to have that a priori belief, and having now looked at this for a couple of years, I'm like, this looks like one of the stories I'm looking at for this next season is a story Kaiser Health News did last summer about a woman who got sent by her insurance company to Mexico to have hip surgery, or maybe it was knee surgery. They were like, look, we'll do it this way. Instead of going to the hospital near you, we'll fly you to Mexico. We'll fly an ace surgeon in from another state, pay him his top rate. We'll take you to the best hospital in Mexico. You have no deductible for this. You have no copay. You have nothing. In fact, we're going to write you a $5,000 check. Yeah, and one of the most interesting things about that is that all that got arranged. I mean, and obviously the insurance company, which in this case the employer is paying the bill directly, is like still coming out ahead on the deal, right? And that is on top of a fee for the little brokerage startup that brokered the whole deal, right? So to me, this suggests some people, when they saw that, sort of tweeted like, see, markets will fix this. And that's not how it looked to me. It just looked to me like, there's a lot of money in there that's not going to a good purpose. I could get a piece of it if I were able to carve out some value. So that's how just pragmatically, that's how I tend to look at it. I think that that's one way to look at it, just like pragmatic. That's how I'm not an expert. It's people who are experts. When you ask people who are looking to run for office, right, then the answer you're getting are all, and I think if you're asking about like, what do we do? Everything's a bank shot, right? It's like, well, if I say this, who votes against me? Do I get elected? And if I get elected, what are my chances? If this is my position, like, how do I steer? And that, like, Obamacare was an example of this. And 25, 26, 27 years ago, the attempt of Clinton Care was an example of this. Of like, how do we make something that'll steer its way through without getting taken out head on by the American Medical Association, the insurance industry, private equity firms that have increasingly taken a big piece of healthcare, right? Like all those interests have lobbyists. All those interests have that. When we did this story about surprise billing, one thing that happened is surprise billing has gotten a lot of attention in the last few years, and in the last year, Congress was like, we're going to do something about it. And over the summer, bills came out of committees in both the Democratic-controlled House and the Republican-controlled Senate to say, we got to do something about surprise billing. And then Congress broke for summer recess. And then members came home and found ads running in prime time from groups that no one had ever heard of called Doctor-Patient Unity. They said like, oh, big insurance wants to have, and other people want to have government set rates, and that's going to cause doctor shortages, and hospitals will close. Tell your congressperson to vote no, and nobody knew who they were. And so reporters from Kaiser Health News, actually, the first ones to do this, figured out, oh, Dr. Patient Unity was funded by the hedge funds that own the physician staffing firms, right? And that legislation did not go anywhere. It stalled. So, the question of like, what's a kind of pragmatic, like how would you do things, like what would be a smart way to organize things from my perspective, and again, people study this stuff, I don't know. And what do you advocate for, and who do you back as a political candidate? in some ways, like two different questions. Like the second question is so, who the hell knows? I don't know. Gotta ask somebody else. I'm working on this self-defense angle for now because I don't think we're going to get a solution that way. But I'm like, if somebody finds somebody who's got a good one, like, sign me up, right? Yeah.
It sounds like you work sort of at a micro level with an individual and their story, but there's the macro thing. And how do you balance those two? And what's your goal at the macro level?
Yeah, the goal is like, fix it, right? Let's fix it at the macro level. I think each of these individual stories, I mean, the way I see it and the way we tend to tell it, like, goes to this macro level, right? So this question of this one person and the bill they got for $35 that goes to $1,300, we're like, that episode, we tell the story of this surprise billing legislation, right? And we're looking at the story of like, what's the law? What does the law say about whether someone can do that to you? And, the next question is like, well, okay, you have this right. That's great if you're a young, healthy person with a single instance of a bill for $35 that wants to get to $1,200 or $1,300. What if you're desperately ill and don't have the kind of energy to do that kind of fight? And what if you're desperately ill and therefore you don't just have like one stupid bill for a blood test, you've got like pages and pages of charges, right? I don't have a macro answer for that, but that's like we rate, like those questions we raise. One thing I say about myself is like, I'm not a guide. It's like I've come to see this as like we're walking through a battlefield, all of us, and there's like, shrapnel flying everywhere. And some of us have the kind of health insurance that protects us as kind of armor. But a lot of us don't. And a lot of us, you could wake up like this year, you may have different health insurance from your employer than you had last year, and it may be less good, right? We're all vulnerable in different ways. We are all connected to each other. We all see in our Facebook feeds or whatever, our friends' GoFundMe accounts, like we're connected. So on this battlefield, I'm not a guide who like knows the whole territory, and I'm not a general with a battle plan. I'm a scout. That's my training as a reporter. And I'm just doing my best to use my training and my skills to kind of look around the next corner and be good about figuring out what corner would be good to look around next and sizing things up and reporting back. And I just have to do things one at a time. So I don't know. That may not be a satisfying answer, but like every one of these little stories is the big story. I just don't have an answer for the big story.
Hi.
Yeah.
Thank you for the show. Do you know of a location where the healthcare is working well, any country or any place? And the one follow-on is there was an effort by Jamie Dimon, Jeff Bezos, and Warren Buffett. Do you know where there was a big splash
2 years ago? Yeah.
And I haven't heard anything else after that. Do you know where that went?
Super good questions. There are two questions, right? One is, where's it working? And the other is, what about this thing that happened 2 years ago? So we'll get into. So the first one is, I don't know, but I hear on Twitter all the time from people. I hear an email from people from, Canada, from England, from Australia, from Sweden, from Finland, who are all like, I listen to your show and it's just horrifying. I can't believe you people live this way. This is awful. I can't look away. So, there's an indication that there are multiple places out there where where people seem less dissatisfied. So this other story you're raising is really good. And it was one of the things that I noticed when I was starting this show. I was like, So 2 years ago, there was a big announcement that Jamie Dimon, who runs JP Morgan Chase, and Jeff Bezos, who runs Amazon, and Warren Buffett, who's Warren Buffett, they were like, we are teaming up to fix healthcare. Yeah. They're like, we're going to start something, and it's going to be big, and because they all employ a lot of people who need health, who get sick and need healthcare, need health insurance. Like, this is costing us a lot of money. We don't know what we're going to do, but we think we can do something. We're smart. And the last I really knew about it was, that summer, they announced they had hired a CEO, a guy named Atul Gawande, who's a writer for The New Yorker and a surgeon at Harvard and an author of books that I really admire. And I was like, that's a good pick. That guy's really smart. That's the last I've heard of it. I have not heard they gave up. Anything could happen. But I don't know. I don't know what's happening with that. Yeah, thank you. Yeah.
Thank you for your talk. Fabulous that you were able to turn this into an ongoing, successful project. I wonder if you might be aware of an or a website called nutritionfacts.org. The MD who runs that has a huge collection of videos and a book with the title "How Not to Die." And it's fabulous in that he finds scientific evidence that all sorts of diseases can be reduced by following a plant-based diet. So I just wonder if somehow you might connect with that and obtain a synergistic effect.
Thank you. I'll look it up. I'm always looking for good advice about how not to die. Yeah.
What's your take on healthcare accounts? Let them start them early, even when you're born, for example, and have them tax-free and let them grow. And, don't force the people to spend all the money in 1 year. Just let the account grow.
I don't know. It's not something I'm familiar with. It seems to me it's hard to imagine putting enough money away to really, for me to feel safe. Because I get a lot of email, I see what happens. Bills, the charges that people get exposed to are, add up to the tens of thousands or hundreds of thousands of dollars so quickly. So it's hard, but I don't know. It's not an area that I know about. Yeah.
Hi.
Hey.
So if we did go to universal health care, how do you imagine that would affect how Medicare sets prices?
Such a good question. I don't know, right? This is in this area of the macro fixes. There are people who have spent years training as economists and policy people who have I'm a scout. I don't know. Yeah. I imagine it seems like if one entity was doing all the negotiating, they would have a lot of leverage. But that's a completely intuitive, it's intuition on my part. Yeah.
Hi, thanks for your talk. On the internet, I've seen stories about what are the best states to retire in, and one of the things, the factors that they say that they're considering is that healthcare costs vary so much from state to state, and I wondered if you could tell us why it would be so much different in Tennessee from Nebraska or whatever.
I have no idea. I'll tell you one story that I've kind of got an eye on, though, that's a state-to-state story about retirement, is that I was reading about and I learned is new. So long-term care is a big deal, right? And Medicare doesn't cover it. And a thing that happens with a lot of people is that Medicaid does cover it. And so one piece of advice people get is drain all your assets or put them in a trust someplace and let Medicaid take care of you. And there are states apparently where Medicaid is after you die, they're great, now we want your house. So that's a thing. If I were looking at kind of best places to retire, that's one of the things I'd be looking up. But why so much more and less in other places? I don't know. It sounds like a good story.
Have you ever heard a definition of health care?
Oh, do you have one?
No, I'm asking you.
It's a super good question. I don't know. No, I don't know. One of the things that, I will say, the episode our most recent episode is an interview with a woman named Catherine Jacobson Raymond, who published a book called Crooked, Outwitting the Back Pain Industry. And she suffered from back pain. She's a reporter, suffered from back pain from the time she was a teenager. It got to the point where she was like, I need surgery. And she went to sign up for surgery, and she was like, this does not smell good. This doesn't seem very, I may need to check this out more. And she spent 6 years researching medical treatment for back pain. And what she found was most things that get prescribed and billed for back pain don't work. They're ineffective. Some of them are destructive. That lots more people get surgery than are good candidates for surgery, for instance. And the outcomes from those surgeries can be very, very bad. What the conclusion that she came to was that, after a lot of research, was that the chronic low back pain is not a medical condition. She's like, it's been medicalized because it's really profitable. Like, one of the most interesting parts of her book is, like, she said she looks at MRI. She's like, one thing you definitely should think a lot of times before doing is getting an MRI if your back is killing you. Which seems weird, because, like, don't you want that information? And the answer is like, well, no, because it's very likely to show that you have, like, bulging discs or, herniated discs. And it turns out there's studies of asymptomatic people where most people, adults, have such artifacts if you give them an MRI. That it turns out that there may be a few cases where, like, that leads you to information that, like, indicates you'd be a good candidate for surgery, but most often that kind of chronic low back pain, like, those things are artifacts like gray hair and wrinkles, and they're not connected to the kind of pain that many people experience, and that what we experience is a combination of being deconditioned because we sit too much and we don't exercise our bodies in the ways that our primitive ancestors did, and the way our brain works, which is, like, you twist the wrong way or whatever, and you get this horrible spasm, it doesn't go away. So it turns out that's, like, your brain going, like, wait a minute, we don't know what's happened here. You just gotten hit by a bus, in which case nobody better move. And, like, you don't. And actually, if you were to, when someone she knows has an attack of back pain, she's like, get down on the floor and do these little exercises with me. And after a few minutes, they're like, oh, I feel better. And it's not because the exercises themselves change things. It's because their brains got the information they're actually okay. So all of this stuff, the surgeries, the opioids, which have been a big part of that, like, were not, they weren't indicated. And the interesting thing is that the people she identifies a class of people she calls back whisperers. And some of them are physical therapists, and some of them are Pilates teachers, and some of them have all kinds of titles that I never heard of. They're often not covered by insurance. Like, the whole field of, like, effective, targeted, relentless exercise that's effective is not actually like, there's not a kind of umbrella under the world of evidence-based medicine where there's a kind of structure for studying it and licensing it. So that's an example of, like, well, what's healthcare? Like, I don't know, man. It's a super interesting question. It has big implications for the kind of stuff I'm interested in. But I don't know. Yeah.
With pharmaceuticals, has anyone tried to reverse the law that Clinton had, where you can't go to Canada to purchase pharmaceuticals? Is there any attempt to allow pharmaceuticals to be imported from Europe, where they're a fraction of the price?
This is outside of my area, but my impression as someone who reads headlines is like, yeah, politicians talk about that. I don't think we have it, and it's in the realm of, like, political questions that I don't have a good answer to. That I don't have authoritative knowledge of, like, where the politics of that sit, what the law is. I don't know. Someone here probably knows more than I do.
Thank you for your talk and your advocacy. I have worked with lately a lot of seniors who get sold Advantage plans versus PPO plans, and I feel like that's a way to rip them off. And we'll give you exercise, and we're going to give you lectures and glasses. And then they go for an operation and they have to go home. They're alone. They get no time. So I heard a rumor that they're trying to totally discontinue PPOs and get everybody into this Advantage plan. You won't be able to buy good coverage at a certain point. So that's kind of scary. I don't know if you've heard that.
No, but now I have. Thank you.
So you mentioned Obamacare a few times. Obamacare is the biggest health policy of my lifetime. And I remember the dialogue switching at one point from trying to control healthcare costs to trying to insure everybody. Mm-hmm. And my impression is that we haven't controlled healthcare costs. Is there any evidence that insuring everybody has helped to reduce the cost of healthcare?
Not that I'm aware of. I mean, but which is to say, it's not a question that I've studied and other people have. But like, not enough, right?
Thanks for your talk. I was interested in the woman who said, here's a way you can lower your bills. Is there a business then that does this? Why doesn't everyone, as soon as they get their bills, calling 1-800 lower your medical bill as the first call? When I get my real estate bill in Chicago every year, I get lawyers sending me letters saying, call us first, we'll lower your bill. Is this out there?
That is a really good question. I don't know. I mean, these companies exist. I did talk with, like, when I made my round of calls to people who do this for the "can they freaking do that" story, I did talk to somebody who was like, well, I bought this business. It's a tough business. It's a tough business. I've talked to people who've tried it, and it's a tough business partly because, unlike a property tax bill, which is a predictable, and now I'm speculating, but that's a predictable expense every year, and you know what the lawyer knows just what letter to write, and it goes away. Often it's like case by case, like which doctor will play ball with you, which ones won't. And it's also often the case that, like, people have this, it's one thing, people have some overwhelming bill. If I'm going to work for you and do this, I'm going to take a piece of what you save, but you may still owe more than you can afford to pay. Right? If you're getting hit up for, like, more than the price of your house, and I'm like, I'm going to save you a third of that, and I'm going to want a third of what you save. Yes, it's better for me, but where am I going to get the money to pay you? Right? But I don't know. It's speculation on my part.
Hi, thank you for your talk today. My question is, it sounds like a lot of your stories are from people who have insurance through work, or, they've purchased insurance. What is your experience like? What's the percentage of people that you talk to who come to you with issues from being on Medicaid or some of the Obamacare plans? Thank you.
Thank you. I mean, people, Medicaid, I don't hear from I don't know. Yeah, I don't know. I mean, it's not scientific. It is what I can tell you. Yeah. I mean, Corey and Caitlin, their plan was an Obamacare plan. Each one of us has our own menu to choose from. And I've done 24 episodes so far, and I've gotten hundreds and hundreds of stories from people, and there are millions of stories out there. So I'm not making any effort to scientifically sample anything. Yeah.
Yeah. What part do you think monopoly plays in the increased cost of healthcare? Because you don't find any doctor anymore that is an individual and doesn't belong to monopoly.
Yeah, it's huge. It's huge. And it's not just like there's total monopoly and there's consolidation, right? And yeah, it plays a big role. One story we did, where it was kind of eye-opening for me, was building on a reporter from Kaiser Health News did about obstetricians in the Bay Area. And she talked to this one woman who was an independent obstetrician, and she could not get a raise from insurance. And she was very dedicated and wanted to run her own practice. Her mom had run her practice in the same town. But she was like, I can't get a raise. And she went to the insurance. The insurance was like, we're not giving you a raise. You can take it or leave it. You don't have any market share. We don't have to talk to you. And this reporter found out what doctors get paid by what different providers get paid. And it turned out that, like, in the Bay Area, she was like, this doctor gets $2,000. Stanford Medicine gets $5,000 for just a generic delivery, and the University of California gets $8,000 for the same service. And the logic behind it is market share. It's all just like, Stanford Medicine can be like, this is going to cost you $5,000. Insurance company, and the insurance company's like, that sounds kind of high. And Stanford Medicine's like, well, you're going to be selling your policy to employers, and those employers are going to be telling their employees where they can have their babies. And some of them are going to want to go to Stanford Medicine and have fun selling your insurance policy that doesn't include Stanford Medicine. And the insurance company's like, how much did you say that was again? I guess we'll just have to raise our premiums. So that's, for sure, huge. And that insurance companies, the thing that I learned from that is that insurance companies, like, it's not just they don't have leverage, they don't have a true incentive to bargain really hard, which had always been my assumption. Like, oh, insurance companies are trying to get those prices down. But, like, ultimately they're just like, well, we'll raise the premiums. Yeah.
So it looks like there is no short or long-term solution. We're all for ourselves. So on your website, do you plan, or maybe do you have a section with like how to list, or like consolidated information where people can go and start something, start researching how to help ourselves?
Yeah, it's on the list for this year, for sure. Thank you. Yeah, we've been like making the show, and now we've got to figure out how to be effective in other ways.
So you mentioned that you get pitched a lot of stories, and I'm wondering if you could share one or two that like you started to investigate, and then for whatever reason they didn't become podcasts, you had to abandon them, but you wished you could have.
I don't know. I don't give up so easy. Yeah, but I mean there are examples, but they're not as interesting. Yeah.
I don't know if this is something that you have knowledge of or not, but all the other countries that do it a different way, I'm curious if you have any knowledge about how they ended up on that track. I have some understanding of, the steps that wound up with our system, but was there sort of a moment in those countries when they were like, no, we need to be on the universal side?
I don't know. I mean, my impression, I know so little about this. My impression is like, England created the National Health Service after World War II. That was a decision. It was like a Labour government. And they were like, we're going to do this. I just told you like everything I actually know. Yeah.
Okay. Well, this will be the last one.
I was wondering if you had looked into quality of healthcare. So the disparities of the healthcare quality people are getting, because that's another thing that I think when I think about even other countries' systems is sometimes they're getting higher quality healthcare, but sometimes they're also not. Like they're waiting long times to get treatment. And so I weigh that against our system.
Yeah, I haven't made a study of it. The top line stuff that I understand is that like the outcomes here are lousier on average. And that there's a science fiction writer named William Gibson who likes to say the future's already here, it's just not very evenly distributed. And there's I think people talk about rationing and waiting and stuff, and I would say like that is all here, it's just not evenly distributed. And so again, like what I mainly know firsthand, is there are people who study this. Is how many people I hear from in other countries who are like, I can't believe what you people put up with. So, I don't know. I do hear, they often say, if it's like more than one tweet, like, our system is not perfect, but holy crap. So that's my understanding.